Doctors of Reddit. How is the interaction when a patient is a doctor or has medical knowledge? There's a curve. Taking care of someone with a non-medical background is fine. Taking care of someone with an extensive amount of medical knowledge, also usually fine. Where it becomes difficult is when it's someone with some medical knowledge. It's usually someone who works in or has worked in an ancillary field, but never as an actual clinician. That's when you come up against a Dunning-Kruger effect, in which that person, patient, or family member believes they know as much as more than the medical team when they actually don't. Those are the worst. Taking care of doctors has always been a breeze. They know the limitations of their own knowledge. Taking care of mid-level providers, NPs, etc. is usually equally as easy, though with exponentially increased amount of anxiety and number of questions. Taking care of nurses is hit or miss. Some of them are very compliant and easy to care for. Some are an absolute nightmare of TikTok influence. And I did my own research. Taking care of CNAs, vet techs, etc. is almost always a huge beating. Full Dunning-Kruger effect in play there in the medical field, but typically have no actual knowledge or, more importantly, ability to discern good information from bad. There are exceptions, of course, but the second they lead with a vet tech CNA, I know I'm in for some transparent disinformation getting in the way of their good outcome. And almost anyone can fall prey to. But my sister's friend's roommate's cousin says, not a doctor, but am married to one that doesn't use Reddit. Medical doctors tend to be fine. Has in a niche field. They understand the limitations of their own knowledge, and that standard protocol may have changed since they learned about the field. He tries to avoid mentioning his career with he's a patient. I hate receiving medical care with him around. Some doctors and nurses will use highly technical terms to talk about what is happening with my health or our children's health, not bothering to tell me what's happening. When that occurs, hell, wait to see if they're going to translate for me, turn away from them, tell me everything they should have, then ask me if I have any questions for my doctor. It also happens when he's not around if they somehow know. I'm a nurse who works in surgery. I was going through discharge instructions and information with parents of a small child who just had his tonsils out. They were super nice, and then right before they are about to leave, I find out they are both pediatric critical care physicians. And I made a joke saying, wow, I was preaching to the choir, and they said no, we appreciated being treated normal. And then I've had other situations where I'm explaining how to get ready for surgery, and I get a lot of eye rolls. And then I make a joke like, something don't you? And I usually get them to smile, and they admit that they have a ton of medical experience, and then I tell them they're always welcome to refuse any interventions they don't see fit, or tell me if they don't want a speech they already know, lol. I try to just be as real as possible. Actual doctors tend to be fine. I know when I go to the doctor, I made a point to defer to them because I am the patient, and they are the specialist. I end up asking more specific questions than someone who's not a doctor, but that's it. The people who are the most difficult are those who have basic medical knowledge and assume that means they know as much as or more than doctors, or people who have done too much Googling or TikToking and get mad when an actual medical professional assessing and treating them contradicts what they expect to hear and or receive for treatment. Many times my explanations fall on deaf ears or are interpreted as confrontational. Or the patient seems to expect medicine is now purely a service industry, meaning I prescribe them whatever they demand, rather than a consultation with an extensively educated and trained physician, where I perform an assessment about diagnosis and best treatment, provide that information to the patient. I've learned to stop engaging with these people and just advise them to consult someone else who may better align with their expectations. Arguing with them is not worth the frustration for me and makes them more inclined to post exaggerated or fake negative reviews online. This issue has increased about 10,000% since the pandemic. I am a CRNA, and nursing assistants are the absolute worst to take care of. Physicians are usually the best. Sorry guys, I am a nurse myself, but it's the truth. I'm an NP and I sometimes see MDs as patients. They generally give excellent histories and have good insight into their condition. I treat them no differently than I would anyone else. I just know that I need to be on my A game when I'm explaining things, since they do have so much more context for understanding and asking questions. I would take seeing an MD any day over seeing some retired RN or massage therapist or someone who took a few biology classes in college 20 years ago who insist on challenging me over everything I say. I don't mean like asking informed questions. Some people are just really rude for no reason. It's interesting doctors as patient often understand the risk better. They also underestimate their own symptoms because they're used to seeing worse. Honestly, depends upon which side of the room I am on. When I'm the patient, I want to be treated like any other patient. I've had lots of doctors ask me what else they think we should do, asking for my medical opinion. And the gesture is very nice and shows respect, but also my area of expertise is one specialty, and I appreciate having someone else lead the expertise part when it comes to my health. Obviously, plenty of time for me to raise a concern if I vehemently disagree with the course of action, but that has yet to happen. When I'm the doctor, I like knowing if the patient has healthcare medical training. This is more so I can use more technical terms, which adds a little bit of efficiency to the visit. I would otherwise treat them like any other patient. I'm a paramedic, not a doctor, but I've had doctor patients. The most memorable one was a lady who got drunk and busted her head at a football game. She refused to let us do anything for her besides bandaging. When we got to the ER, I told the charge nurse it was a head injury, and the patient said it's more of a laceration. Charge nurse said, "Is it on your head?" Lol. She also gave the full report when we got to the room. I said, "Yep, that pretty much covers it." Healthcare workers are notoriously bad patients, lol. I know a lot of people who will conceal that fact just to avoid any drama, but personally, I find it helpful to mention because it tends to speed up explanations. Also, one time I had a tech sneak me a suture removal kit, told me to hide it from the doctor and tell me I should apply for a job there when I was in the ER for a dog attack. So there are benefits, lol. At the very least, I didn't have to make a follow-up appointment just to remove a few stitches. From what I've seen, doctors usually don't get mad if you're right. They just care how you got there. If you say I Googled it and this matches my symptoms, a good doctor will check it, either confirm it or explain why it's something else. The vibe is more okay, fair point than how dare you. Generally easier. There are a few exceptions, of course. I find that when my patient is a doctor, the interaction is a lot more of a conversation. They are able to weigh in on the recommendation, and we bounce ideas off of each other. Generally, I find them to be respectful and willing to accept my recommendations as long as I can back them up. Occasionally, you get one who comes in giving orders. At times, I've had to draw a line. Any orders, referrals, or prescriptions I give will be reflective of my own opinion, without exception. Anyone who is unsatisfied with that can go see a different doctor. It's really tough depending on the situation. Treating another doctor in general sucks. You either over-explain or under-explain, usually under-explain. It's really best if you don't know they are a doctor. People assume you know everything about their field and don't give basic instructions because they expect you to know. You also have enough knowledge to know what the acronyms those medical students are whispering about your newborn child, or enough to recognize what D cells mean on the strip, and know that your OB is busy with some C-section that is taking priority over you. They will largely let you direct your own care even if you're too messed up on medications to really be making complex medical decisions for yourself. They often don't explain the significance of any lab results. Again, because they expect you to know what normal is for every lab. I find having some knowledge just makes the provider have to actually work to explain why or why not my thoughtful questions or concerns are legitimate or should be followed up on. I mean, guys, how many AskReddit threads do we see where people report having to advocate the out of their concerns, and had they Googled something, they could have gotten some answers or symptom relief? Most of the help I've gotten for medical problems have not come from doctors. They don't have time to help you. Plain and simple. The good ones find a way, but it's rare. And the system is designed for that. Anyone who doesn't practice a certain way is squeezed out. Get a second opinion. It's not always just in your head. This was suggested to me. And remember that at the end of the day, you are the one who has to live with symptoms, diseases. So education is key. Except, of course, if you didn't go to medical school, then you just don't understand. I'll say it was not fun taking care of a person whose parent was heavily involved in their care, and parent happened to have experience working at a medical school. Unclear what degree they had at first, then eventually came out they had a job where they coordinated mock physical examinations. basically scheduling the actor patients so medical students could learn physical exams on real people. So, parent basically had zero medical experience, but they were happy to initially imply they did, and even when it was clarified what their experience was, they continued to act as though they knew as much or more than the physician. Highly educated people typically recognize each other, and it streamlines things. It's a bit like when you're interviewing employees and you can talk to someone who is faking it and someone who has been in the trenches. It's a lot of details that snap together to create recognition. The problem is when they have medical knowledge from Google or AI and confuse that with understanding. If they come in and think they already know the answer and are just looking to get a certain outcome, it can be exhausting. Usually fine. I will say, I usually don't tell my own doctors I'm a doctor unless it's relevant. When I went to a fertility specialist once years ago, I let it slip and they were like, "Oh, you're a doctor so you know about the who's-it and the what's-it," and I wish they had explained like M5 because it wasn't my field at all, and I remembered very little of it from med school. 99 of the time perfectly fine and actually quite pleasant. Very rarely, I'll take care of another physician in a different specialty who thinks they know mine and don't understand the standard of care. Nothing in medicine is conceptually difficult, but some things take more than a couple of Google searches to learn, even if you have an MD. MD in a surgical subspecialty here. I prefer to know when a patient is a physician because I can use more accurate technical language, and as a patient, I prefer the care team knows I'm a physician because they can use accurate language without translating it to everyday English. Not a doc, but an experienced RN, you can basically immediately tell if someone is actually a medical professional or not. The way they interact and know which questions to ask at however, some medical professionals are, so they're difficult regardless. Nurse, but I have a ton of empathy for worried doctor or nurse parents who come into the ER with their kid just in case. Because they've seen the freak cases as I have, who are supposed to be quick run-of-the-mill visits and end up with a bad diagnosis. Someone who pretends to be but isn't actually clinical comes at me in bad faith when I'm trying to help them and uses a little info they don't have a good grasp on to try to bully or attack me and my team. That's not okay. Easier, because they will answer my questions directly and not go on a tangent about something that happened to them 10 years ago when I ask if they've had some symptom recently. Having other doctors as patients is incredible. It's so streamlined. It's like that one movie where Jackie Chan and Jet Li fight each other Forbidden Kingdom. You could tell it was two experts communicating and it felt incredibly natural. I need to say that ER docs and general practitioners should not prejudge the knowledge of a patient with a relatively rare, long-term condition. You are not necessarily trained on that illness while the patient has been suffering for years. That isn't to discount your intelligence or training, but you are not a specialist, and we have specialists for a reason. If I have another ER doc try to give me acetaminophen for hemiplegic migraines, and am not drug-seeking, but a cigarette would do me more good than Tylenol simply for how migraines are not a typical headache. They are vasodilation, not vasoconstriction. MAPCP, I tell my fellow doctor patients to tell me what they want and cut the BS. I have not had a problem. It's that easy long as I'm okay with it, and I would do the same for a non-doctor patient. There have been a few times I've declined requests even though they are doctors. As an EMT, I went to a patient who was a retired EMT, had been on the job 40 years. I was like, "Here's my first in bag. I'm sure you know how to use all that stuff." I have no medical training, but am highly educated and scientifically literate. I understand correlation does not equal causation, the basics of stats, the limits of evidence, etc. I also seek to learn as much as I can about the conditions that afflict me. My doctor says he likes dealing with me. I think that is because I know enough for clear communication, and also enough to know I'm not a doctor. Sometimes kind of awkward, usually fine. Sometimes bad for the same reason any intersection might be bad. I never really know how much detail to go into when my patient has medical knowledge, but not necessarily in my field. Every single one of my mother's doctors and nurses have asked me if I'm a doctor or nurse. Not because I know it all, but because I'm excellent at explaining her issues, and I, as one noted, effortlessly pronounce medical terms. No medical background whatsoever. I'm simply neurotic and have also been watching Grey's Anatomy since its inception. Not a doc, but an experienced RN, you can basically immediately tell if someone is actually a medical professional or not. The way they interact and know which questions to ask, however, some medical professionals are, so they're difficult regardless. My husband is a doctor urology and I have a lot of gastrointestinal issues. At those meetings, he has no input because it was a blocked subject 6 years ago. He knows his lane and stays in it. Not a provider, but I have a medical physiology degree and used to teach clinical reasoning. When I've been a patient, I've occasionally had doctors been annoyed by when I discuss my symptoms and possible diagnoses. However, most of the time they don't mind because my visits become quick and easy. I know what I'm talking about and they don't have to simplify explanations. Residents do get a bit surprised when I see them, because I clearly know too much, but they get over it pretty quick, lol. I'm a retired cardiac specialist technologist nurse, and spent a lot of time training new physicians on medical technology. After 12 years in retirement, I feel left behind in the field. At this point, I don't let my providers know my past affiliations, as I find they tend to assume I understand the most current clinical recommendations and approaches, which I absolutely don't, especially if they are outside my field of training. They discover my previous medical knowledge when I ask the appropriate questions. Patient here. I thought this was funny. I was neat and well-dressed when I met my new psychiatrist. I was going for ketamine therapy for chronic pain from cancer treatment. I had done some reading here and there, and I found out about telehealth at home ketamine therapies. I mentioned it to him and said, look into this. It might impact your business. With a curious look, he asked me if I was a doctor. I'm a retired RN. I'm able to cut through the BS and call docs out on the financial incentives they bring into the decision. I advocate for myself only and not them. If the patient is a doctor or, like me, a PA, it's usually fine. They tend to want to get right to the point, don't need a lot of explanations, can easily participate in shared decision-making, and have realistic expectations. When the patient's family is a provider, however, there often can be some power struggle, as in them wanting to tell you what to do. Same is true for doctor-doctor dynamic, but certainly not always. TBH, the worst is usually when a family member is non-physician medical worker. Could go into detail, but don't want to offend anyone. I am a veterinarian and board-certified small animal internist. Some MDs, DOs respect my knowledge and others stay super basic. I don't go and self-diagnose, I am paying them to make the diagnosis. But humans and pets share many of the same disease processes, so I dislike it when I am patronized and not included in the thought process. However, many value my questions and input and ask about similar things in my patients. They always give themselves away. They use a term not used in common parlance, or they pronounce a difficult term way too effortlessly. However, every once in a while, you'll run into some truly wild entitlement from folks, such as one lady who was snobbily criticizing her nurse's care and trying to dictate what tests I should order for her because she works in healthcare. When I asked her what she does, she says I work front desk at a pediatrics office. I'm an ER doc, but I try not to let people know that I'm a doctor when I get treated. People tend to order way too many tests, or conversely avoid uncomfortable tests or questions for other medical professionals, and the so-called VIP syndrome tends to actually lead to worse medical care. An example, my PCP was initially hesitant to tell me that he should perform a testicular exam to check for testicular cancer, and I had to reassure him I wanted him to do everything he would for a non-physician. Another commonly studied example is a female doctor comes in complaining of pelvic pain. You hold off asking questions about partner history and miss the diagnosis of pelvic inflammatory disease that ends up causing permanent infertility. Another example is the same patient, but you are hesitant to do a pelvic exam because she's your colleague and you miss an ovarian torsion that kills her. It's a sidestep for sure, but I trained as a veterinary technician in the US in the mid-2000s and moved to Australia in 2017. I did not practice in Australia. I did not even practice in America, LOL. Way too stressful. I ended up doing pet sitting, pet shops, overnight kennel daycare grooming facilities, even a brief research lab gig that turned into an IVF lab thing until I moved countries. Anyway, I brought a cat from the US with me, and he was diagnosed in Australia with GI lymphoma. In America, when I'd state I had vet tech experience, they'd appreciate that they didn't have to use layman's terms, but they'd still do everything because they didn't want to risk you getting hurt by your own pet and possibly bringing litigation against them. In Australia, My clinic was like, "Oh yeah, experience? You looking for work? Here, can you hold your fractious cat? It's enema time." "He bit the out of me!" I don't blame him one bit. I told her a million times I'd rather he bit me than any of her staff, and her be more gentle with me than any of them, lol. They also happily sent me home with fluids for him anytime I'd ask, because they trusted my previous experience even though it was years old. Loved that clinic, lol. Too bad we moved away. They also adopted to us our next kitty after Stratus passed away, and they comped most vet stuff for Tonks whenever she needed anything done, since she'd been their clinic cat. As a pharmacist, when I am seeking care, I try to hide that I am in the medical field, as I know there is a lot I don't know, so I want those layman's terms. Many years ago, I was able to have a conversation with a doctor using medical terminology. I don't remember why I knew it, but the doctor smiled, and we cut a half-hour of conversation about my condition down to about 6 minutes. I managed to keep up with him, not sure how or why, but the diagnosis was quick and certain after just a few tests to verify. Maybe he appreciated not having to sit there listening to any long-winded descriptions of symptoms. Or maybe he was just happy a patient turned out to be right for once, but I sure appreciated him not going straight to condescension. Doubt I could ever do that again, though. I bet that doctors find the internet quite annoying, whereas patients are concerned, as they probably come up with all sorts of misdiagnoses for themselves and then reach out to the doctors for solutions. Not a doc, but an experienced RN, you can basically immediately tell if someone is actually a medical professional or not. The way they interact and know which questions to ask, however, some medical professionals are, so they're difficult regardless. When in the doctor, I find generally other physicians are fine. I treat them the same as any other patient, including my explanation as my field is fairly niche and has a lot of high-tech advances. Nurses and other clinicians are a hit and miss, typically have fairly insightful questions, but tend to be a lot of questions. Sometimes the questions are really crazy though and totally off the mark. As a patient or family of a patient, I try my best to sum up things for a smoother consult, but defer to the expert for their expertise. Not a physician, but a doctor PhD in biology, background in human immunology, disease, epidemiology. If it is a doctor I'm going to be seeing multiple times, I try to let them know my background, and for the most part, they will discuss things with me more openly and straightforward. I've been with my GP for 10 years at this point, and I've noticed over the years how he's become much more receptive to my input and concerns. I've even been able to show him studies for a course of treatment that has been helpful. I'm a scientist with a medical-related PhD. My docs usually include me in their treatment decisions, and for some ailments let me take the lead with their guidance. I've been on lithium and mood stabilizers for 20 years. I make all the change decisions, and they just order my scripts. For things that are new to me, I obviously let them lead. I see you've met my MIL, who believes her jobs as a secretary in a mental health clinic and playing bingo with old people in nursing homes qualifies her as a medical professional. My genuine frustration with doctors is that they won't try to help me. I'm in pain, I know something is wrong with me. If you don't know what it is or you can figure it out, then say that. But don't try to convince me nothing is wrong with me. Something clearly is. My mom decided to argue with my neurologist that my anti-seizure medication dosage was too high because I took more milligrams a day than she did of her anti-anxiety medication. I was in college and she came with me for moral support. She never came to another appointment with me after that. Reminded me of a funny thing that happened a couple of years ago. I took a really bad fall, and sitting in the back of the ambulance, I started taking stock of myself. Noticed my collarbone had a huge bump over it and felt weird, so mentioned to the EMT that it might be broken. Nope, just looks that way, she told me. She was the professional, so I didn't argue. Turns out it was clean break, as were 5 ribs. Never really understood why she reacted that way. Veritasium on YouTube recently published a video on how commonly people are confidently wrong. It was disturbing, especially people who would say they are 90-100 certain when they were more like 30-50 correct. It's odd. I know enough emergency medicine as a paramedic and science from grad school to carry out intelligent conversations with my PCP and kids' pediatrician about things, ask questions, and interpret lab values for my wife. Once I start delving into subspecialist stuff like pediatric nephrology and hepatology, I get in over my head real fast and I know it. It's weird to know some, but not enough. I'm no doctor, but I work in EMS. The amount of people who do this to me because they Googled their symptoms is so common, and it drives me insane sometimes. I used to tell my wife to stop trying to out-doctor the doctor. It's great to be an advocate for a family member or yourself, but telling the doctor how to do his job is a bridge too far. I hate that there are enough dumb know-it-alls that I'm always worried about being labeled as a Dunning-Kruger patient when I ask more detailed questions. I'm not an MD, but I am a geneticist working in diagnostics. My job requires me to be able to interpret clinical information about a lot of different conditions, sometimes in great depth. So if I'm asking you a really specific question, it's not because I'm in with WebMD, who's trying to prove I know more than you. I'm actually trying to understand and thought I'd ask someone who knows what they're talking about instead of attempting to look it up later. I recognize I'm likely on the peak of the Dunning-Kruger curve as I am more of a hobbyist. Just fascinated by medicine and spend a lot of time researching and learning. At least I recognize I don't know, but my doctor actually quite likes me because I ask very specific questions and never make assumptions. She's actually been trying to convince me to go to medical school. Oh man, my friend was studying to be a phlebotomist and I had to take her to the hospital for something. The doctor was trying to explain what was happening to her, and she kept jumping in with random medical info that tangentially related to what he was saying. I have to give it to him. I could see the rage in his eye. Friend never caught on, but he stayed calm and listening to her, and then just went back to what he was saying. I did not have that level of patience. I shushed her multiple times. It was 3 a.m. We had been there for 10 hours. I just wanted to go home. Bruh, this is my mom. She was an Air Force medic during Desert Storm. Lord, she was a pain in the when I got cancer. I just started calling her doctor. Google. Yeah, this is the answer. I recently had a retired RN inform me that all the medications we were discussing to treat her headaches were poison. Then 5 minutes later, she wanted my opinion on the overpriced supplements she was buying based on TV ads to prevent dementia. Yes, the classic, I Googled my symptoms for 20 minutes, so I'm basically a specialist crowd. My aunt's a nurse, and she says the worst patients are always the ones who've watched too much Grey's Anatomy. There's plenty of medicine which is derivative and far outside of another physician's wheelhouse, and most of them know that. Some of those conversations aren't too different from regular patients. I've also been to doctors who start talking like, I'm a doctor, and they pause and say, honestly, it's faster if I just do my thing, and they give their usual talk to the regular patient, and that's just fine too, and I don't care. Where an aspect of this made a big difference in medical care is having my father, who's getting up there in years, able to give an upper year resident level clinical summary of himself, and arm him one or two good question about his treatments, as it's gotten him a good bit better care without having to call in for every appointment. I describe myself as knowing just enough to be annoying. I do trust my doctors, but I view my health as a team effort, so I want to understand what I can. Funniest experience was at the vet. My cat has allergies, so they were going to give her a prednisone injection. As the vet started to explain in basic terms, I said I'm autoimmune, so I've used prednisone myself. So the vet modified her explanation to my level, which I appreciated.